Good evening. My name is Crystal Walker, and this is my informative speech about the physician-patient relationship. The physician-patient relationship is directly affected by the communication that they share. According to my health law textbook and the internet, both state that communication is the key element in providing high-quality care and leads to patient satisfaction and health. The communicative relationship between these two can have either a positive or negative impact on their bond. I will tell you how physician-patient relationships result from effective and non-effective communication in dealing with patient welfare, the patient complaints, and importance of communication as a whole. The physician's primary objective must always be the welfare of the patient. Patient welfare is anything that is in the best interest of said patient. Welfare of a patient consists of their medical needs or wants, financial needs or wants, and their privacy needs. Patient welfare can affect the physician-patient relationship too. When a physician doesn't put the patient's needs or wants at the forefront of their treatment, it is ultimately the patient who suffers. When patients feel they can't trust their care to their physician, it shows the physician-patient relationship is severely damaged, which is true, because if the relationship that they had wasn't damaged, they'd be able to express themselves. The communication would be, better. Patients' complaints are grievances or disputes they have with their healthcare provider. Verbal complaints as well as written complaints are forms of communication and play a role in the physician-patient relationship. Again, it's all related. The relationship will be either negative or positive based on the results of the patient's complaints. When a patient complains about services rendered by a medical practitioner, it's that practitioner's job to fix what the patient is complaining about. And by that, I mean, if a patient is complaining to you about, okay, maybe you don't have a good bedside manner, and they communicate this to you, it is up to you as the healthcare practitioner to not let what they said upset you, but to more so let it inspire you to fix your relationship. It's ultimately the patient who is going to suffer if these complaints go unheard. They may leave your practice. They may, complain to someone else about you. So to prevent all these things, I would say it's in your best interest to fix the problem at hand. So yes, the medical practitioner can either fix the initial complaint or complaints, or do nothing and let the relationship deteriorate from non-effective communication between them. There are different types of physician-patient relationships that factor into how both parties communicate. Examples of non-effective communication are paternalism, which means dominant doctors and passive patients. So the doctor will take on a parental role, whereas you do as you're told. I talk at you. That's what paternalism is. And consumerism, which focuses on the patient's rights and the doctor's obligations. Basically, either party talks at each other and nobody really hears what is being said. Mutuality is a shared decision making, and that's an example of effective communication because both parties listen to what the other has to say and can give, verbal or written feedback. There's no misunderstanding, misinterpreting. There's an open line of communication. Therefore, their bond is going to be strengthened because there's trust. If I can talk to you about my grievances and you give me feedback and we come to a mutual decision together, I'm going to trust you with my care. Pardon. In closing, to have an effective working relationship between physicians and patients, there has to be communication. The patient's welfare, their complaints, and the way they communicate with one another influences the relationship that they share. The communicative relationship between patients and physicians can have either a positive outcome, such as decreased anxiety, guilt, pain, and disease symptoms, or a negative outcome, such as trust being lost, lawsuits being filed, patients leaving the practice. Physicians must be dedicated to continuous improvement in the quality of healthcare, as well as the ties the physician-patient relationship stem from. So, I hope you guys have a better understanding of the physician-patient relationship and how it's affected by communication. And I hope you enjoyed my informative speech. I'm going to try to kick this cold. Good night and goodbye.